Aphasias are a group of disorders that are characterized by lost or reduced ability to understand or express language. There are a variety of causes, but they generally focus on damage to particular regions of the brain that can come from things like strokes, tumors, multiple sclerosis, seizures, or migraines, the most common of those being the stroke. Symptoms tend to stabilize by about 6 months after whatever the primary incident was, though there are examples where patients have gotten either better or worse over the course of time. And factors that impact the way a patient recovers include how old they were when the incident occurred and what type of treatment they receive. Aphasia can also rarely occur as a part of the aging process, and this is termed primary progressive aphasia or PPA. And this generally occurs due to the same degeneration instead of injury. As an example, we can see on the left here a relatively healthy looking brain scan, and on the right, a severely degenerated one. The underlying causes of this degeneration can be very diverse and in some cases not explained, and it can also go along with other issues such as memory loss. There are many types of aphasias, but two of the most common are the fluent and non-fluent aphasia. Fluent aphasia is when a patient can speak with a normal rate and tone, but the words they're using are illogical or without a standard direction or meaning. In these people, reading and writing is often impaired, and they may not be aware that the words they're using doesn't make sense. On the other side, non-fluent aphasia involves broken speech patterns, and so these patients can experience something like the words are on the tip of their tongue, but they just can't quite get them out, or in extreme cases, even muteness. In these patients, comprehension remains intact, so this can become very frustrating that they feel like they can express something, but they just can't quite get it out. And sometimes reading is intact, but then writing may become challenging for these patients.
By using communication charts with pictures or words, individuals with fluent aphasia may be able to associate visual cues with information being communicated via speech.
We're going to order dinner. What would you like to eat? Would you like a chicken sandwich or chicken nuggets?
I'll have chicken sandwich.
It is helpful to remove distractions when communicating with individuals with fluent aphasia and talk about things that are relevant to the current context in order to focus the conversation.
What are your opinions of my new pillows? Sorry, this is kind of distracting. What are your opinions of my new pillows? I'm thinking of getting a new couch and more supportive seating for my home.
I like this.
Breaking down instructions into simple steps while using visual cues is a useful strategy in communicating with individuals with fluent aphasia.
Can you grab the bag? Can you open it? And could you hand me a pen? Thank you.
When communicating to someone with non-fluent aphasia, try to use yes/no questions or give them a few options to choose from.
Hey, are you thirsty?
Yes.
Can you point to what you want to drink?
Sprite?
Providing tactile cues can help individuals with non-fluent aphasia retrieve the words that they are looking for.
Hey Andy, could you hand me no.
This? This?
A pen.
By using communication charts with pictures or words, individuals with non-fluent aphasia can point to show what they want.
I've been at school all day. I can't wait to get home and watch some Netflix. What do you like to do when you get home? Would you mind pointing? Oh, awesome. I love watching TV too.
In conclusion, aphasia is common in elderly patients who suffer from vascular or neurodegenerative disorders. In most cases, aphasia occurs suddenly after a stroke. The communication strategies outlined throughout this video can be utilized to effectively talk to patients with aphasia.